Next up in our discussion is chloramphenicol. This one inhibits peptide bond formation. It binds to the large subunit in the ribosome, so it will be the 50S subunit of the bacterial ribosome, which is total 70S. So 70S, when you see that, it means bacterial ribosome. 50S is the large subunit of that particular bacterial ribosome. It is synthesized chemically, has a broad spectrum. It would be great if it didn't have so much toxicity to humans. So the problem with chloramphenicol is really that it has a lot of side effects. It works great on bacteria, but it really also, it can suppress the bone marrow, it can affect blood cell formation, you'll be anemic, and have other side effects as well. So while it works great and it is cheap, it still has some issues, and so it's rarely used because of the side effects. So here's what chloramphenicol looks like. And then now moving on to aminoglycosides. The amino sugars linked by glycoside bonds or glycosidic bonds, they change the shape of the 30S. That's a small subunit of the bacterial ribosome. And they can cause also some side effects, auditory damage, but still, nevertheless, they are very popular. Streptomycin, neomycin, gentamicin are all popular antibiotics that are pretty widely used. Next up, tetracyclines. They are produced by Streptomyces species. They interfere with the tRNA attachment to the ribosome. They're great. They have a broad spectrum. They penetrate tissues, making them valuable against rickettsias and chlamydia, so these intracellular parasites, parasitic bacteria. However, they can suppress the normal intestinal microbiota, and it has really caused a big problem. Tetracyclines, when they became available, they became immediately very popular, and some people started to take them daily, like as if they're popping vitamin pills and taking it as a daily supplement. And it has led to a lot of problems. Number one, your normal microbiota in the intestines is suppressed, and so that makes you much more susceptible for like irritable bowel syndrome and other kind of problems with your microbiota. Also, it can affect, if you give children a lot of tetracycline, it can discolor their teeth and makes them kind of grayish, dark colored. But here's the structure of tetracycline. And next ones are the inhibitors of protein synthesis. There you have the glycocyclines. They have the advantage that they're useful against MRSA, the methicillin-resistant Staphylococcus aureus. Next, the macrolide antibiotics. They have a macrocyclic lactone ring that is the effective component of the chemical structure there. The most famous of the macrolide antibiotics would be erythromycin, and then other derivatives of erythromycin, and they work against gram-positive kind of bacteria. Here's an image of what the macrocyclic lactone ring looks like from erythromycin. So it's pretty nice. It's like the star-shaped. But moving on to more inhibitors of protein synthesis, the streptogramins, they're pretty famous. They attach to the larger subunit of the bacterial ribosome and work against gram-positives that are resistant to other antibiotics. Then we have here the oxa drugs, oxazolidinones. They bind to the 50S/30S subunit interface, so between the large and small subunit of the ribosome. And they can be used against methicillin-resistant Staphylococcus aureus, which is always a plus. And the pleuromutilins we don't need. Moving on to those antibiotics that injure the plasma membrane. So there we have lipopeptides. The one that you should need to know is the polymyxin B. That's very popular. That one is used in the triple antibiotic ointments that you can purchase. So it's only topical, meaning only on your skin, on the surface. You cannot take these drugs. They would be having too many side effects. They are effective against gram-negatives and usually combined with bacitracin and neomycin in these triple antibiotic ointments. So you can take a look at the label if you have one at home. It contains polymyxin B, bacitracin, and neomycin. In the group of the nucleic acid synthesis inhibitors, we have rifamycin. That one inhibits mRNA synthesis. Then next up, quinolones and fluoroquinolones. I'm not sure if you have heard of those. Maybe ciprofloxacin. This one is actually fairly often prescribed. They have a pretty broad spectrum, relative non-toxic, meaning good selective toxicity. And then sulfonamides, they inhibit folic acid synthesis, which is needed for protein synthesis and so for metabolism in general for bacteria. And so if you don't have folic acid, then these bacteria, they cannot thrive. Sulfonamides, that's probably the only chemical that really came out of that shotgun approach where people were just looking at anything on their chemistry shelves and were looking for, does it have antimicrobial activity? And if yes, can we survive it if we take it? So the sulfonamides, that's the only successful drug that came out of that approach. And sulfamethoxazole is often given together with trimethoprim as a combination drug because they have a synergistic effect. That means the two combined have a larger effect than what you would add by what you would find if you're adding them individually together. Here you can see how sulfamethoxazole and the trimethoprim, how they would work together to block the formation of folic acid and then thereby block the formation of DNA and RNA. So these two drugs in combination work together to block the nucleic acid synthesis. Moving on to antifungal drugs, we have these the antifungal drugs. They typically affect the sterols. So that means that the fungal cell membranes, they need sterols, and if we are inhibiting this, then the membrane will be more permeable than it should be. In this class, we have polyenes. You may have heard of amphotericin B. That one's a pretty popular drug. Maybe more popular would be the azoles, like imidazole, triazole. They are very typical antifungal drugs. Clotrimazole, that one is maybe the most popular antifungal drug on the market. That's an imidazole. Allylamines we don't really need. Here's the structure of amphotericin B. And next up here is the structure of miconazole. Continuing with antifungal drugs that affect the fungal cell walls, there will be the echinocandins, and agents inhibiting nucleic acid synthesis would be flucytosine again. Then here, continuing, we have the griseovolva next. That one is produced by penicillium and inhibits microtubule formation. It's active against superficial dermatophytes. Tolnaftate would be something to point out. That one is that's your typical antifungal that is in creams that are used to treat athlete's foot. And pentamidin we don't really need. So now moving on to antiviral drugs. We have entry and fusion inhibitors first. They would block the receptors on the host cell that bind to the virus and would allow the virus therefore in. So that's basically just preventing the virus from getting into the cell. And then we have uncoding, genome integration, nucleic acid synthesis inhibitors. They prevent, as the name indicates, viral uncoding, inhibit viral DNA integration into the host genome. And the nucleoside analogs, they inhibit RNA or DNA synthesis. They are basically false nucleotides. And here would be an example of a false nucleotide, the drug acyclovir. That's a very popular antifungal drug. Can you see how the guanine nucleotide looks different? So it definitely has a different structure. So when this false guanine is incorporated into the DNA, then the DNA basically doesn't work, and you can't do transcription or replication with these false nucleotides, and thereby you're inhibiting nucleic acid synthesis. This slide here shows you how acyclovir doesn't have an effect on normal cells, but only on virus-infected cells, because the thymidine kinase in the virus-infected cell will lead to the false nucleotide, the acyclovir, and that one, once it is incorporated into the DNA, then DNA polymerase will be blocked by these false nucleotides, and replication will not occur. Moving on to more antiviral drugs, a very popular class of antivirals are protease inhibitors. Now, once the virus is in the cell and it's instructing the cell to make more viruses, one of the biggest components to make more viruses is the assembly. And for that, you need to have a protein coat that is custom cut for the virus particles, and that requires protease enzymes. If you block these proteases, then the protein coats will not be able to be made for the virus, for the new virus particles, and of course that will inhibit an antiviral drug. Now, any of the antivirals so far, they by themselves don't have much of an effect. The HIV treatment became effective when people basically, in an act of desperation, put everything on the shelf that's antiviral, put it together in one big cocktail, and that's now called the highly active antiviral treatment. So that was then the success. But by themselves, each single one is not super successful. Lastly, the exit inhibitors, there you would have a drug that prevents the virus from budding off of the host cell. Now, interferons, we mentioned them earlier, they once held the largest promise on being sort of the miracle drug for virus infections, but it turns out they work inside the body locally when cells communicate with one another, but for some reason as a drug they never really came through to be as effective as people had hoped for. So theoretically, at least, they're supposed to communicate to cells that they need to guard themselves from imminent viral attack. They are produced naturally by virus-infected cells that want to communicate to their neighbors that, hey, I'm virus-infected, protect yourself because I might spew out a few thousand virus particles. And it works locally in the body, but it hasn't been that effective as a drug, probably because it's hard to get the drug in the right concentration into the tissues. So here, the antiviral cocktail that is used to treat HIV/AIDS patients, there you have this whole, well, basically everything we have on the shelf that's antiretroviral in this case is taken together. Some of these are currently candidates to be tested out for the coronavirus patients. But here, this antiretroviral cocktail contains nucleoside analogs of false nucleotides, another false nucleotide, non-nucleoside inhibitors, protease inhibitors, integrase inhibitors, entry inhibitors, fusion inhibitors, the whole thing, everything we have. Moving on to antiprotozoan and antihelminthic drugs. We have the antiprotozoan drug quinine and chloroquinine that have been used for decades, if not centuries, to treat malaria. A very old drug, comes from a plant, and currently, and don't ask me why, some people are promoting chloroquinine as a treatment for coronavirus infections. I'm not sure how that would work, but hey, if it works, I'm sure people would want it. Then we have artemisinin. That one kills Plasmodium, that causes malaria as well, and the metronidazole, that one Flagyl. It interferes with anaerobic bacteria, treats Trichomonas, gardiasis, and amoebic dysentery.